Now, if the pain obviously persists, a lot of people say, well, when should I call the doctor? So we want to give you some pointers on when you should call the doctor because the pain is just too much. And here are some suggestions that we have for you. If your pain started after you fell or were struck, doctor, you feel weakness, numbness, or tingling in your legs, you have bladder or bowel problems, your pain is getting worse or isn't going away. Kind of like sum that up for me, if you will.
Yeah, so these are really the key indicators, Olga, of when you should see your physician. If you fell, if you were involved in trauma, that could be serious. You could have fractured a bone. We're going to talk later about fractures of the spine. And so if you fell and you hit hard, it's really important to see a physician or perhaps go to the emergency room if it's that urgent and get checked out, make sure there's no fractures. Or if you were struck by something, so if you fall into something, that could also cause a fracture. It could cause a serious injury. If you have weakness in the lower extremities, that's another indication that you need to be seen and evaluated and have some workup done. If you have numbness and tingling that goes down the legs, so-called sciatica, for example, if it goes down one leg, but if it goes down both legs, both of these are very important to see your physician about because it could be narrowing of the spine, pressing on the nerves, or what we call a pinched nerve commonly. And finally, if you're not getting better, you need to see your physician because we know that most sprains and strains, which we'll talk about, get better. 90% of them get better within a few weeks or less. If it's not getting better, something else is going on and it needs to be evaluated by a professional.